All right, good morning, and thanks for joining us, everybody. We're so glad that we have such a really great turnout today for this important and really ever-growing issue. We know nationwide, 1 in every 4 people struggle with their mental health at some point in their lifetime. Within that group, it's really critical to be considering the needs of one particularly vulnerable group that's often left out of the conversation, which are homeless high school students. So today we want to discuss why it's necessary to reach out to homeless high school students or teens to ensure their mental and emotional needs are met with support. Right now, there are roughly 1.3 million students who are homeless in the United States, including over 100,000 in New York City alone. Of those, 41% struggle with depression. It's kind of a stark realization, but it means that over 1 million children are struggling to have their basic necessities met, and all while fighting for their emotional and mental health needs. To mark Mental Health Awareness Month and shed light on this traumatic burden that homelessness does put on students, we're going to be discussing the key findings today that are connected to a report that we've put out, discussing the mental health and well-being of homeless high school students, More Than a Place to Sleep. The full report is available for download online at icphusa.org. I'm Anna Shah-Amwa, Senior Policy Analyst from the Institute for Children, Poverty, and Homelessness, and my colleague Liz Cohen is also joining us.
Good morning. I'm Liz Cohen, and I'm really looking forward to being part of this conversation today. Leading up to the webinar, we asked you all out in the field to share stories from across the U.S. of the intersection of mental health and homeless students. And it's my privilege today to bring some of those stories into the conversation as Anna presents the data. So for those of you who are not familiar with us, the Institute for Children, Poverty, and Homelessness is a policy research organization that focuses on family homelessness in New York City and throughout the United States. Our goal is to provide policymakers, elected officials, advocates, and community members with information that will further data-driven decision-making about the factors affecting family and child homelessness. All of our research, our data, and policy briefs, everything is available for free download on our website, icphusa.org. On a quick technical note, you should see a window on the right side of your screen if you're using a desktop computer. And please feel free to type in any questions you have along the way, and we will do our best to get to them all.
For people, and especially for kids and teens who experience homelessness, this is a trauma that's affecting their lives, and not just during the experience itself. Homelessness has lasting impacts on students' school stability and attendance, can cause kids to act out behaviorally, just really impacting every aspect of their life.
Anna, the first word that jumps out at me from what you just said is the word trauma. Mm-hmm. And we're hearing this word so much these days, and what I think is a really important departure from how we traditionally talk about academic outcomes. For instance, we heard from an organization in Virginia that said that when children are impacted by trauma, it often shows up in their behavior. And this isn't that surprising, but what we thought was interesting is their use of art therapy to help children heal and address the trauma that they've experienced. And in fact, we know many organizations are adopting a trauma-informed model of care. And this is crucial because it means that the mental health of these children is being considered. As one New York organization shared with us, this stresses the importance of remembering that we're working with humans who need to know first and foremost that we care about them as humans and as individuals. And I would add also as children in this particular case, and that these kids are really more than just another statistic.
It's so important to keep in mind. We know that mental health is just as important as physical health, which is why spreading awareness of these mental health needs and also the supports that exist is key. One audience we need to also consider is schools and educators, since many students who have experienced the trauma of homelessness and some of the impacts on mental health that you see on the slide here, they're at a much higher risk for receiving suspensions.
I love how you point out the importance of mental health on academic outcomes. I think this is something that's really becoming more widely accepted, but also it means that we in the data and research world really need to think critically about how we incorporate mental health into our work. But it's clear from what we're hearing from the field that this isn't news. For instance, a homeless coordinator in Wisconsin mentioned how important it is to understand how mental health issues may compromise a student's ability to engage and participate in school. Catherine from Georgia furthered that idea by stating that stress and trauma can translate to behavioral issues in the classroom and an inability to complete work, which I think ties into that suspension rate issue that you were mentioning.
Absolutely. That's something we've definitely seen in our research, that many of these mental health effects that you see on the slide and also other challenges that are associated with homelessness, they make it hard for students to attend school and can cause them to be absent as well. So if we can think about how to address all of those challenges from absenteeism to suspensions and so many others, with counseling and social work supports or out of school supportive programs, they could help reduce those educational impacts and make sure that homeless kids have the same chance of accessing a quality education as their classmates who live in permanent housing.
I think one great example of this is from Kiara in Washington State. So she told us that youth experiencing homelessness are often forced to operate in survival mode, which is really just focusing on meeting their basic needs. But then that means that attending and excelling at school takes the back burner. And this makes a lot of sense, but also is just really sad that these kids, instead of thinking about prom dates or college applications, basketball tryouts, are instead they're wondering about their next meal and where they can sleep safely each night. So not only do we need to work on helping these homeless students reclaim a childhood, but we have to make sure that schools and service providers have the tools and resources to help them address these terrible traumas. Another great example that I really loved learning about is something called the Youth Supportive Services Team, shared with us by one New York nonprofit. And so this team actually works with the whole family, provides families with on-site counseling, as well as doing school advocacy and support. The organization believes that any type of support or connection to after-school extracurricular programming, etc., will likely improve the students' morale and self-esteem, and that in turn will help improve school performance.
That's so awesome. We really need these new and innovative ways to approach things like school performance, and as well as the other needs of homeless students. When we look at the experiences of teens who were homeless, they're undergoing so many more challenges that can make their life more difficult and make it hard to cope. Data from this survey told us that 1 in every 4 homeless teens had been hurt by an intimate partner. Another 1 in every 4 had experienced bullying at school, and 1 in 8 felt so unsafe going to school that they stayed home. So amidst all of these challenges, what we see on this slide is that homeless teens were more likely to experience depression, with 43% of homeless teenagers who reported feeling depressed, and that was compared to 28% of their peers who lived in permanent housing.
So, Anne, I want to just repeat 2 of those statistics that you just shared that I think really frame the reality of these numbers, that 1 in every 4 homeless teens experienced bullying at school, and 1 in 8 felt so unsafe going to school that they just stayed home. To me, I think not only is this shocking, but also it's an important piece of the puzzle to consider when we're trying to address the issue of chronic absenteeism in our homeless students. And we also heard from the field firsthand about the link between bullying and depression. Margot in Georgia pointed out that, as we've established, homeless children sometimes suffer from depression. But she also went on to say that in her experience, she has seen that depression caused by bullying, and also sometimes that can arise from children seeing where the homeless kids are currently living when they're getting dropped off by the school bus, which can just add to the stigma and the burden that these kids are already carrying.
Sure, it's important to consider. And it also goes even beyond problems with feeling unsafe to basic needs, too. When we looked at the data, we saw that homeless students only slept an average of less than 5 hours a night, and many didn't have access to breakfast before school or other meals. So when thinking about the higher rates of depression among homeless students, it becomes clear we need to be thinking about all these underlying challenges and the everyday difficulties that kids who live in shelters or other unstable homeless settings are facing.
Exactly. I think giving students the skills, confidence, and support to overcome these obstacles is absolutely possible. Another great example of this came from Florida, where we heard the story of Terrence. Terrence became homeless 1 month into his senior year and he wound up in one organization's emergency shelter. He said the organization taught him that there is help and that while each individual challenge is different, no one is alone in their battles and that there are people who will stand with you through the thickest times. Organizations like these really do offer great supports to children and homeless students by taking care of their basic needs so they can focus on doing well in school.
Mm-hmm. So, addressing depression among homeless students is really essential. And we also see that these challenges go beyond depression, which is really scary, especially when we consider that about 23% of homeless students had considered suicide, which was twice the rate of housed students. When we think about what this really means for our school populations, though, that was over 5,000 homeless students who thought about ending their lives. Looking at the total number of students with suicidal thoughts citywide, 1 in every 5 was homeless. And that's a really significant proportion. So, interventions and counseling that seek to lower these rates have to take into consideration the additional support needs of homeless teens.
So many of our homeless students are just crying out for help or they're resorting to these drastic measures because of the immense burdens they're facing at such a young age.
Mm-hmm.
Kirsten in Arizona is an art therapist working with adolescents and young adults experiencing or at risk for homelessness. And she got in touch with us to tell us that homelessness forces her clients to shift focus from the normal developmental tasks of adolescence to the survival tasks of getting basic needs met. So, like we heard from someone else before, again, there's that idea of just focusing on survival.
Mm-hmm.
But Kirsten also shared some results of a survey of her clients done by Arizona State University that found that 40% of their youth had thought about suicide in the last year and 18% had actually attempted suicide. Kirsten emphasizes the importance of trauma-informed care, as we've been talking about, and also says that building trust and rapport is the most important step in working with these youth and beginning to address their mental health needs.
Even going a step beyond thoughts of suicide, homeless teens were also more likely to attempt suicide. So, while overall 11% of public school students were homeless, 1 in every 4 high school students who attempted suicide was homeless. So here again, we see that the the individual support needs of teens who have lived in shelters or other unstable or homeless settings, they have to be taken into consideration if rates of suicide, self-harm, and depression are all going to decrease.
So much of our mission here at ICPH is about putting homeless children and families on the policy agenda. They've suffered in invisible silence for too long. And sometimes these statistics, they make me want to scream and cry, but also hearing these stories and knowing that there's all these folks, all of you who are listening today and the folks that we've talked to who are working to help these kids each and every day is really powerful. We have almost 700 people who have joined us today for this webinar from across the nation. And so we want to make sure that you leave here today with some ideas of what's next. And first, I'll just say that, yes, we will be making this PowerPoint available as a bunch of you are asking. And I'm so glad that you want to be able to have this to refer to afterwards. But in addition to that, I would say that educating the public and elected officials about the prevalence and impact of homelessness, that's still our first battle. Has your local paper written about student or family homelessness in your city or county? Can you provide them with stories of how homelessness is adding to the burden of poverty and how programs and services can help homeless students succeed?
Data is also really crucial to getting the attention of media and policymakers. What data do you have at your disposal? Or, where could you collect more or better information about what's happening with homeless families? Even as we heard, an informal survey of students or families that your organization is supporting can yield valuable insight and be informative.
Homelessness is a national problem, but it's a local issue. So while most of the data we're presenting today comes from New York City, we also know that the specific solutions that are going to be needed are going to be different in Carson City than in Burlington. And our goal isn't to tell you or anyone what those solutions are, but instead to provide you with the data and analysis to advocate for your community about what's needed. And of course, we also welcome partnership with organizations across the US to help you harness and assess your data and strategy.
One example of how we're using data to push the conversation around homeless students are interactive tools, which right now focus on New York City. And these are places that you can also download raw data, as I see some of you are asking about. We have one tool that allows the user to dig deeper into the health data that you saw in today's presentation. And so you can find outcomes, including everything that we showed you today, as well as other outcomes relating to nutrition and physical health and behaviors of homeless students. And you can find that all and download that on our website. And then we also have an interactive map of student homelessness, which you see on the slide here. And that lets the user look at individual schools, school districts, community resources, and more. And it's just been updated to include a layer involving homelessness in charter schools as well. And so you can find all of that data and access it. We're able to respond to what advocates, educators, and policymakers want to know and understand, and make it available in an interactive tool.
In the coming months, we'll be releasing an interactive map for the state of California, and we'd love to talk to anyone listening from California or even from other states about ideas for tools that will be actionable and contribute to policy conversations.
All right, let's turn to the questions that you've all been asking. And you can also feel free to continue submitting questions as we go in the chat box.
All right, Anna, so what is the data source for all of the data that we've presented here, and what year is it from?
Sure. So the data is from a survey given in 2015. And the data source is the National Youth Risk Behavior Survey, which is administered by the Centers for Disease Control. And it's really also administered locally. And so here, this data is just specific to New York City. And the Centers for Disease Control partner with departments in each of the states and localities where the survey is administered, which is across the nation, and they're the ones who ultimately deliver the survey.
Great. Next question is, I'm a guidance counselor in a rural high school district. There's a sizable homeless population, but few services. How can I use this data?
Sure, that's a great question. So what we know is that data really has more weight than anecdotes sometimes, and it can really give you the ammunition you need to advocate for resources. So if you are in an area where there might be resources, but maybe nobody is thinking about the situation of homeless students, this can be a way to put it in front of a superintendent or anybody else, and make sure that they know that these students and kids are really at higher risk for some of these challenges.
Great. Where can I access child homelessness data?
Well, the ICPH website is one great place to start. We have our data looking by school at student homelessness in New York City, and so you can absolutely access that there. And as Liz mentioned, we're going to be coming out with another map on California and continuing from there. And in addition, you can also request data if you're a researcher or connected with the university or anything from your local Department of Education if you're looking for data.
Yeah, school districts are required to track how many homeless students they're serving. So locally, your school district or state Department of Education is really a great resource. I would also add that next week we're going to start at ICPH rolling out our a new publication on state accountability for homeless students, where we are ranking all 50 states on a variety of indicators on how homeless students are being identified and supported. So I think that will be a really good resource for folks who, say, aren't in New York or California. We've
Mhm.
also launched a new partnership with Seattle Public Schools to get access to student level data. So we'll be doing some deeper analysis in Seattle. And so I think we have lots of different sort of irons in the fire, I guess. But
Mhm.
locally, I think, as you said, sort of the school districts and State Department of Education is going to
Yeah.
be a really good place. Okay, so next person says, I read the full health report. It says that homeless students use school health clinics at higher rates than house students when they are available, and that's good news. But school health clinics don't have the resources to deal with serious mental and emotional health issues. How can I make use of the report?
Definitely. So that's a good question to discuss with school administrators. And you can definitely access any more indicators that you want on our website as well to make even a more compelling case than what you see in this presentation. And so for homeless students, we see that just having a caring adult who's aware that there is a problem is a step in the right direction. So this can be an opportunity to partner with other mental health professionals in your area, perhaps. And what we see is that the important thing is to really start the conversation, and then people will really you'll see that there are many resources available in your own
Yeah.
community.
And I just add that I think that we're obviously well aware that, across the country, places are really resource strapped. So saying, okay, we know school health clinics are good doesn't mean that y'all have the funds
Mm-hmm.
right now to make that happen. But I think that's why, for instance, with our New York City map, we've started to include these community resources, because what we'd love to see is, local communities or even neighborhood communities identifying, well, what's already here, right? Do we have a health clinic? Do we have a place for people to get, immunizations? What are ways that we could piggyback additional services into existing resources, to sort of try to, you know, get more people to have access to the kind of services and help that they might
Mm-hmm.
need.
And many of those people in the community may not know or may not be thinking about the specific challenges of homeless kids and homeless families. And so putting this data in front of them can really open the door for those partnerships.
Right. All right. Here's a question I've been wanting to ask you,
Okay.
which is, so we've been talking a lot about homeless high school students, but what do we know about elementary or middle school students?
Sure. Well, unfortunately, the data is just not there. But that's not to say that it couldn't be. Currently, this survey is administered in high schools and really captures the outcomes of teens. The departments of health also do an additional survey, the risk behavior survey. This one is the youth risk behavior survey, that can capture outcomes of more people in the general population. And so if there were an opportunity to add questions asking about homelessness and housing status the way that they've been asked on the youth risk behavior survey, we could get more of that data.
Yeah, that would be great.
Yeah, I mean, currently, all we know is that there have been, studies done by independent researchers showing that many of these effects do occur in kids, and especially young kids who are experiencing housing instability and that trauma at a really young age. It stays with them.
Right. That makes sense. I mean, I know from my own more K-12 education background that certainly anything we're seeing in high school, we're very likely to be seeing in middle school, as well at this point. So, I think it's great for us to be thinking about how we could try to expand our understanding of what's going on with these students. So we have some questions here around, is the bullying is okay. So do we know if the bullying is because they're homeless or just that they are bullied?
Well, that's a really interesting question. So this person is wondering if it's uh, about just their housing status or because of things associated with homelessness, like their hygiene, clothing, etc., other things that might be difficult to access consistently. And it's an interesting question. What we do know is that homeless kids are at a far greater risk than kids who are living in permanent housing and who are not in that emergency situation of their parents having to worry about where they're going to sleep that night, and may not have the time or the resources to worry about, laundry and school uniforms and other things like that. So that's a really interesting point, and definitely points to why we need to be considering all of the additional support needs of homeless kids, because the fact is that many may not have access to breakfast that day, or may not have had a stable place to do their homework the previous night. So those are all considerations that from educators to everybody we need to be asking.
Yeah. All right, so someone else is asking, what is the relationship between a child who has experienced homelessness and school dropout rates?
Sure. So we know from our education research that there is a very strong correlation that kids who have experienced homelessness, whether in high school or in middle school, have a higher risk of dropping out. And that risk is really amplified when the student, within students who are homeless, those who experience more instability in their home lives and also their school lives, that also places them at a greater risk for dropping out.
So you're saying that if they're transferring schools more, or they're moving back and forth either between different homes or shelter and not shelter, that they're at greater risk.
And yeah. Because those things make it much harder for students to attend school regularly, and that makes it really hard for them to graduate.
Yeah, absolutely. Although it also makes me think about the work we did with the graduation data from New York City. And obviously we do a lot of New York City work as well as some state level work. But in New York City, we were able to show that homeless students who don't move around and don't transfer schools, so they're homeless for all 4 years of elementary school, living in a city homeless shelter, and their graduation rates were above the city average?
They were above the citywide average.
Yeah. So that, I mean, I think to us, that just speaks so much to the fact that we know these are students who we can help, they can achieve, they can graduate. And it's really about figuring out how we can remove these kinds of obstacles. Mm-hmm. And I think in this case, also just making sure that they also have the support so that when they're dealing with depression or bullying or this variety of mental health issues we're talking about today, that we can help them get through it, because we know that they can achieve and succeed at the same or even higher rates than any other student out there.
Absolutely.
Okay, so this is going to be our last question for today, which is, are you also tracking how many homeless students are pregnant and or parenting themselves?
Well, the Youth Risk Behavior Survey does ask questions about that, and you can, I don't remember the exact numbers, but you can access them on our website, icphusa.org, and go to the interactive data section. I do remember that that homeless students in this survey were about twice as likely to have either gotten someone pregnant or be pregnant themselves.
Yeah, that sounds about right. So we know this is a big issue. I mean, in general, I'd say we track anything we can based on, the available data and what we can. But I think that, we're very aware, and that even after high school, I mean, we know that homelessness disproportionately hits families of young children. So in many cases, what we're really talking about with homeless families is homeless teenagers or, in their young 20s who themselves now have young children, and then they're homeless. And so it's really a conversation. The idea of having to talk about, pregnancy and parenting isn't only because of the students. It's part of this whole cycle of homelessness and poverty, and is a really important aspect for us to understand. And we're always looking for data to cover anything we can get our hands on.
All right, so it looks like that's all the questions we have time for right now. But if you do have additional questions or comments, or you want to get in touch with us, you can go ahead and email us at info@icphusa.org. Or you can also tweet us at ICPH_homeless. In addition, a video of this webinar is going to be available on our website. If you're interested in hearing more from the stories we shared today, be sure to follow us on Facebook. I hope you'll find this data useful, and I invite you to look through our website for more that's going to be helpful to you in your own work. I'll also like to invite you to save the date for our National Beyond Housing Conference in New York City. which is going to be January 10th through 12th, 2018. Registration and the call for proposals are open. Please visit icphusa.org for more information about that. Thanks and have a great day.